right, this is going to be a hard act to follow. This was amazing. I've never seen celiac explained so well. I finally understand it. All right, my name is Aline Charabaty. It's a pleasure to be here. My main area of interest is inflammatory bowel disease, but that kind of naturally led to celiac disease because celiac is also an inflammatory disease of the bowel, even though it's not under the IBD umbrella. And plus, I got to meet this wonderful person called Vanessa Malton, who got me really excited about celiac. So I'm very happy to be here and I appreciate the invitation. So, Dr. Gersner did a fantastic job kind of laying ground of things. In recent years, really things have changed in terms of health priorities. We have done great advance in medicine to decrease the risk of infectious diseases, right? So we have great antibiotic, we have vaccine to prevent viral illness, we have really improve our hygiene, etc. So we don't die of infection as frequently as before. So we made a lot of progress with that. But at the same time, what we've seen is an increase in non-infectious diseases, in more autoimmune diseases. When I was growing up, I never heard of peanut allergy. Now it's like 50% of the table at the cafeteria are peanut-free table, right? We see more autoimmune disease, inflammatory bowel disease. We're seeing more celiac disease. And it's not just because there's an increased awareness or we're capable of diagnosing things. We are truly seeing an increase in the incidence. So I want to go over things with you. What have changed? Our genes haven't changed, right? Genetically, we're still the same than thousands of years ago. So this hasn't changed. What has changed is really our environment. We were talking about Europeans and how they eat and how we try to eat. And that led me to think of, what's going on in our environment here. So a few things. One is, I think most of us grew up playing outside in the dirt, and the only rule was you need to come home when it's dark outside to be home for dinner. I don't think my mother really actually obsessed about me washing my hands before dinner. I don't think anybody really cared at that time. So we played outside, we played in nature, we got dirty, we got our hands in our mouth, and we nurtured our gut microbiome. That's what we're going to talk about today, those bacteria in our gut. We learned how to become more resistant to things and really improve our gut microbiome. And nowadays, kids are sitting in front of computers and their tablets for hours. So they're not exposed to the healthy bacteria of the environment, but also there's no physical activity. And we have so many studies now showing that physical activity actually increase the health of our gut microbiome. Another thing that changed in our diet is food, in our life is food. So we ate smaller portions, we ate less meat because it used to be expensive, we ate more fruits and vegetables and legumes, and we ate smaller portions. When I traveled to Europe and I pay for a very expensive meal for this little plate, I'm like, what's going on? But at the end of the day, actually, we got so used to having cheap food in large amount. And at the end of the day, it's more satisfying to have something that's tasty and small and teach our brain and our gut that that's plenty for our nutrition. The other thing that got into our life is processed food and added sugar. And I apologize for all the Diet Coke and Pepsi lovers, but all that added sugar and artificial ingredient and high amount of processed food is really affecting our guts. These are things that are unnatural substances that our gut is not programmed. Benny was talking about how before we got into our civilized area, there were millions of years where we're not exposed to these things. So our body is not, programmed to take care of things. But even when we try to eat healthy, look at the chicken from the 1950 on your left and the chicken nowadays. So the chicken from 1950, this 2-month-old chicken, look how frail it looks, but that's the chicken we used to eat. And now a 1-month-old chicken looks like 5 times the size. So even when you're eating healthy, if you want to buy your chicken and grill it with some fruits, with some vegetables, that chicken has been fed with growth hormone and antibiotic, and all this is affecting what's going on in our gut and our health. So, what kind of proof we have that food affect our microbiome? This is a nice study that looked at children in Africa, in Burkina Faso, in a village, and then in a city in Burkina Faso, and in children in Florence, so in a more kind of westernized country. those that were in the African village and had a traditional diet with cereals, legumes, and vegetables were compared to those that living in the city or those living in Florence, where they had a diet that was rich in protein and animal fat and sugar. And the children from the village had the more authentic, if you want, microbiome. They had a preserved microbiome that was very similar to when they were born, with a lot of the bacteria that are able to ferment and digest fibers. And children from the urban area, whether from Africa or from Florence, had very similar microbiome and had lost their capacity to digest those fibers. And what happens when we lose the capacity of digesting fibers, we lose our capacity to have something called short-chain fatty acid, and we'll talk about that. So what we eat really affects what's going on in our gut, what kind of bacteria we're selecting for in the gut.
Dr. Charabaty,
yeah.
What exactly is a microbiome?
We're going to talk about that. Yes. For now, it's just a mystery. Okay. And the microbiome actually affect how we eat. So I think those French people got the right microbiomes. If I want a stool transplant, I'm getting a French stool transplant, because they looked at obese mice and lean mice. And what happened is the gut microbiome in obese mice make you actually absorb more calories and less nutrients. So you're constantly more hungry, but accumulating more nutrients than the lean mice. So there's this amazing interaction between what we eat and the microbiome and what we're eating. So to answer your question, where is the answer to your question? I thought I would put it earlier in the slide. You're right. This is too much suspense. So I want to link it at how it links to celiac disease. So one is we're seeing an increase in the incidence. The second thing is that we're seeing later in the onset of life, right? So if it's all genetic and all gluten, why are we not having it only in children? When I went to med school, it was a disease of kids and only manifesting with GI symptoms, diarrhea, losing weight, vomiting, etc. Now we're seeing an adult. I have 70-year-old getting diagnosed, a new diagnosis of celiac disease. And 50% of people are presenting with non-GI symptoms. So most with like skin lesion, joint pain, infertility, headaches, migraine, all kind of things that are related to celiac, but non-GI. So the way we think about celiac disease now, like we think for most autoimmune disease, is that it's a combination of things. You inherit a genetic predisposition, and you're all familiar with HLADQ2, DQ8. These are so all our patients with, or 99% of patients with celiac disease have those genes, but also 30% of the population that doesn't have celiac has those genes. So having the gene alone is not enough to develop celiac. And then something in the environment triggered it. We know the gluten triggered it. But again, a lot of people get exposed to gluten for years before developing it. And also in twins, in identical twins that have the same genes and grew in the same household eating the same thing, if one of them has celiac, the other one has only 85% chance of having celiac. It's not 100% chance. So there must be something else in the environment. Other things that probably affect the gut microbiome, the diet, the infections, the antibiotic, etc. And there's probably also other genes. And those other genes now we're discovering are genes that affect the selection of our microbiome and how our gut immune system behaves, what Benny went over. So this is to answer your question. So what is the gut microbiome? It's actually made of bacteria and virus and fungus, and it's actually we have 100 trillion cells in our gut that compose the gut microbiome. So if you want to look at number of cells, the bacteria in our gut are way more than the cells in our body. If you want to look at genes, we have as human genes 23,000 genes. Those bacteria have 3.3 million genes, all right? And so in total, the number of microbial cells are 10 times more than the number of human cells. So you can say that we're more bacteria than humans. So that took me a long time to accept that. But we have to accept that because there's a lot now that we're discovering about the gut microbiome, and I'm going to keep it in the context of celiac. I know Vanessa, I want to talk about other things, but in working with this talk, I realized how much we're learning more about the gut microbiome and the celiac. So, like Benny's wall was much sexier, but this is my wall. Alrighty, so the gut wall, you have those finger-like protrusion and goes up and down. And it's made, we talk about a wall, and people imagine like it's a very solid wall, but actually it's only one layers of cell. It's one layers of cell, and they have to be tied together. and open up only for nutrients and be very tight together, not to allow all these trillions of bacteria in our gut from getting inside our gut and causing inflammation, okay? So it's a very strong wall, but also a very weak wall. It's just one layer. So if you break that layer, you broke the wall, and the bacteria can get inside the gut and cause inflammation. But let's see how we're living in harmony with those bacteria, right? You would think there's like a war going on in our gut with all these bacteria, but actually, if we have a healthy microbiome, and a healthy microbiome is a diverse microbiome, so diversity is always good everywhere, including in the gut. And so if you have different type of bacteria and a good balance and they're functioning properly, what these bacteria is actually doing, they're promoting our gut health. What they do is that they train our gut immune system into recognizing what's a bad bacteria that we need to be defending ourselves against, and who are the good bacteria that are floating in our gut. What it also does, it digests those fibers. You remember those undigestible fibers we were talking about? So when you're eating onions and garlic and peppers and roots and, these different things that, are harder to digest for us, the bacteria actually ferment that, and they produce something called short-chain fatty acid. Those short-chain fatty acids are so important for our gut health. What they do, if that barrier gets broken, it helps heal it. It helps make it stronger. So short-chain fatty acids are crucial for our gut health. They also control the cell growth and tight junctions. So these gut bacteria are actually helping our cells from being stronger if they get destroyed, from regrowing, and from keeping these junctions tight. Now, what is our gut doing to these bacteria? So we produce mucus, and that mucus actually selects for the type of bacteria that's going to be in our gut and provide food to those bacteria, or also provide what we call antimicrobial peptides. So it kind of fights off certain bacteria to keep them in control and promote others. And that gut, again, wall is strong and prevent the typical bacteria from invading us. But also, if you get an infection, you ate something bad, you traveled abroad, you got an infection, and an infection basically means that a bacteria or virus was able to destroy a part of the gut wall and get in, and you develop an inflammatory response. You get cramps, you get diarrhea, some bleeding. But then your body gets rid of that virus and bacteria, and everything calms down. But what happens in autoimmune disease and celiac and inflammatory bowel disease, once there's an injury and that inflammation starts, it doesn't stop unless we do something about it, okay? All right, so we're living in harmony with our gut microbiome, but in certain autoimmune disease, including with celiac, there's an imbalance. What happened is that there's an imbalance between the good and the bad bacteria, the pro-inflammatory, the anti-inflammatory, the one that produce or ferment our fiber and the ones that don't. And what we've seen in celiac gut, if you take a biopsy from the duodenum and you analyze the bacteria, there's an imbalance. And you don't have to remember those names. I can't remember them. But the idea is that you have more type of certain bacteria and less of another type of bacteria. So the diversity is decreased. And what these bacteria, what kind of gene they're expressing, what protein they're producing becomes different. And the end product of that is that we have less short-chain fatty acid. And anytime we have less short-chain fatty acid, our gut is going to be more vulnerable, less healthy, more prone to injury, less capable of healing itself, okay? So we're seeing that in celiac. So there are a few mice experiments that kind of prove how the gut microbiome might be playing a role in celiac disease. So if we take mice that have what we call commensal bacteria, so the microbiome, so the normal microbiome that mice have, and you give them gluten, nothing happens, right? But if you give them that proteobacteria that we see more commonly in patients with celiac disease, then they actually develop moderate disease. And if you give them a different type of bacteria, E. coli, a type of E. coli that really kind of stick to the gut wall and cause injury, then they develop full-blown celiac disease. So it's not only, so this mice model show us that it's not only the genetic and the gluten that will cause it, but something in our gut microbiome is promoting the gluten from becoming, from causing injury and promoting the inflammation that we see with celiac disease. So what determines our gut microbiomes? Everything, all right? What we're eating, what we're doing. If you have a pet at home, if you're stressed out, if you do physical activity or if you're not, if you're getting enough sleep or not, if you were born by a C-section or vaginal delivery, if your mom loved you or not, but I'm sure all your moms loved you, all right? So everything apparently affects those little mean bacteria that we have in our gut. So one is for celiac disease, the genetic predisposition. So if you look at infants that have HLADQ2, DQ8, and compare them to infants that are low risk of developing celiac, they don't have the genes. Very early in life, their gut microbiome is different. So the genes that we inherit determine the selection of what kind of bacteria we're going to have. But a different study showed that if you breastfeed infants that are high risk of developing celiac, that difference in gut microbiome become less pronounced. So breastfeeding could be protective against celiac disease by altering the gut microbiome, make it more closer to children who have no risk factor for celiac disease. And why is that? It could be many things. In the breast milk, there's IgA, immunoglobulin, and some of you have, maybe celiac and IgA deficiency. So IgA is an antibody that might help the gut to become tolerant to the bacteria of the lumen and not fight against them and cause inflammation. But also in the breast milk, there are oligosaccharides, so a type of sugar, and when these get fermented by our bacteria, they produce again, they promote certain type of bacteria, the beneficial bacteria like bifidobacterium. There's also now evidence that there's increase in celiac disease in children exposed to infections or antibiotic. So Benny did a great job showing how these villi disappear when you have an infection. And that might be enough as an initial injury to allow the gliadin to get into the gut and trigger the changes of celiac. But also antibiotic. Anytime we take antibiotic, and again, I'm not against antibiotic, I prescribe antibiotic. When you need them, you have to take them. But we did become a society where for every little fever, every little boo-boo, we take an antibiotic, right? And that actually really destroys the good and the bad bacteria and really changes our gut microbiome. So it's very important to use antibiotic when we need them. They save lives, but not to be over using them. So again, all these things is really to show you that the microbiome can be affected by our genes, by our environment, where we're eating, if we were breastfed or not, maybe even vaginal delivery versus C-section. I didn't see data for celiac, but for other diseases, there's a sense that the vaginal delivery, when the baby's going, and I apologize for the vagina talk in the morning, but when the baby's going down and getting all the bacteria from the mom, you're already building your gut microbiome, versus with C-section, it's a very sterile procedure, so no bacteria enters the baby then. So there's many things in our environment that determine our gut microbiome and then can promote celiac disease. How about the microbiome and celiac manifestation, right? You have a celiac patient that have mainly GI symptom, others that have more dermatitis herpetiformis, others that manifest with anemia. Why is that if it's the same gene and the same offending agent? Well, it turns out that people who present with GI symptom have a different gut microbiome than people who present with non-GI symptom. So again, the microbiome is going to influence when and how you're going to manifest your celiac disease. Now, what I found interesting is that also when we treat celiac disease, when you're on a gluten-free diet, your microbiome now might not always come back to a normal, healthy microbiome. There can still be changes. And these changes might actually explain why some patients with celiac disease and on gluten-free diet and the serology become negative and the biopsies are normal, still have some symptoms. Right? And it could be because the microbiome is still imbalanced. And sometimes we can treat that with, ironically, antibiotics that can kind of help rebalance the gut flora. Okay? Alrighty. Now, how about if you go on a gluten-free diet? Does it, again, restore the microbiome? Like I said, it might not restore it completely. But also, being on gluten-free diet affect what kind of gut microbiome you're going to select, right? So by avoiding gluten, we're actually avoiding certain nutrients that the good bacteria need to make those short-chain fatty acid. So we're a little bit in a what's it called, like a rock and a hard place. But our genes are affecting things. Environment is affecting things. Being on gluten-free diet is affecting things. Okay. All right. So I'm gonna wrap it up, but this is my. I have one last slide. Basically, then, if the microbiome is really driving a lot of things, can we manipulate this gut microbiome, right? And that idea is very attractive. Can we take probiotic and change our gut microbiome? So first, I want you again to go back to that slide where I said how many trillions of bacteria we have. These are not going to fit in that little pill, okay? It's not going to happen, okay? That's one. The second thing is not only the type of bacteria, it's the balance in between bacteria and how they interact and what they're producing. So that's very hard to determine. There's so much research going on now that we need to understand better, right? It's not just what bacteria you have, but what gene they're expressing on the particular day. All right, so there's a lot of study in mice, but we're not mice. There are a few studies in human, and the results are very mixed. But some studies show that supplementing with bifidobacterium in addition to gluten-free diet can improve the short-chain fatty acid production, can improve the microbiome. There was no improvement in symptoms. But again, some studies show some benefits and some don't. Some probiotic can improve the IBS symptoms. So patients with celiac disease have also more irritable bowel syndrome symptom. So that can improve that, but we're not there yet. So what I recommend for everyone, to leave it on a positive note, okay? So is that overall, we just have to do things that make our microbiome and ourselves happy. Betty showed that French people eat unhealthy food for their pleasure. And, when you go to Europe, you see people eating bread and butter and croissant and foie gras. All these are fatty stuff that in America we avoid, right? And they drink wine and they have these leisurely meals. And here we have small meals on the run that are gluten-free, fat-free, sugar-free. Everything is free, and we're still not healthier than the French, right? So either they have special genes, which they don't, because we know now that worldwide we share 99% of all the same genes. But it's really, I think, about the concept of what food should be. Food should be for pleasure, that's for sure, but it should be as natural as possible, the least processed. One of the things with processed food is, we're adding more gluten to our bread. We're adding more gluten to things, to everything. So it could be that we should be able to tolerate a certain amount of gluten, but now it's so much everywhere that's overwhelming. Also, there's a microbial transglutaminase, actually. So the transglutaminase against which our body react in celiac disease, there's a microbial form that is a food additive. It makes the food last longer, makes it more chewy, tastier, and it's not necessarily added as a food additive. And that can also, add to the problem. So there's so many things in processed food that we don't understand, that I think my advice is that eat as natural as possible. And you want to, again, diversity, a varied diet. It's fruits, it's vegetables, it's legumes, it's whatever you tolerate that's found in natural form. It's good protein. It's replacing gluten-containing carb with healthier carbs, but also taking pleasure in it. We're becoming a society where we're so obsessed and restrictive, and it's not making us healthier. So, and it's also about lifestyle. Taking time to eat gives us more pleasure, give us healthier choice. It's easier to grab a bag of potato chips on the run than actually sit down and have a nice salad with nice ingredients. So what we eat matters, and how we eat matters, okay? Relax, environment, have some wine. I know wine is gluten-free. Physical activity has been shown to boost a healthy microbiome. And again, we're a country where there's the most gym ever. You walk in France, nobody goes to the gym, but they walk every day. They walk to places. They take more vacation. So it's a regular physical activity that you enjoy. If you're torturing yourself on the treadmill and you're miserable because on your treadmill, it's not worth it. It's totally not worth it. A good night's sleep. We stay up late, we're on our phone, we're on the tablets, and actually a good night's sleep has been shown to help with the gut microbiome. So really going back to the healthy living they used to have with trying to balance it with what this modern life needs from us. Live a little bit dirty, and you can take that the way you want it, what dirty means to you, but excessive hygiene is not good for us. Good hygiene is good for us. We live longer because we don't have infection, but excessive hygiene is actually not promoting a healthy microbiome and healthy gut, okay? So you don't have to wash your hands all the time. I have to wash my hand after I scope every patient. But if my kids are outside and something, they drop their sandwich on the floor, I tell them, pick it up and eat it right now, quickly, before the bacteria disappear. Totally. So I'm the crazy mom at the playground. But there's just enjoy healthy food choice, healthy living. That is actually what we can do for our gut microbiome. So on that, I thank you for your attention and for being such a wonderful audience.